in New York City with COVID. We are accepting about 20% of the volume of COVID patients through the city. And so technically, as an ICU doctor, patients will come to the hospital, see someone like my dad. We'll decide if they're sick or not. If they're good enough to go home, they'd never see me. And then if they are sick, then they'll come up to the floor. And then if they're very sick, then that's when someone like myself will get involved. And so my job is to decide which patients need ventilators. And once patients are put on ventilators, how long they have to stay on them, the treatment of these patients. And so my whole long-winded point is that I'm kind of in a unique position to kind of comment on what's going on. There's kind of a desire to scare people into kind of getting serious. But I was working last night, and I think that there's a second kind of feeling out there right now. And I think that this is what I'm feeling right now, is that doctors like myself are in a very unique position to actually empower people. I know you guys have a lot of questions, and we will get to as many of these questions as we have. But the reason I want to have this call is because I don't want you guys to be scared. We're 3 months into this in the medical world, and we understand this disease. I work at probably the premier hospital in New York City. It is a 1,200 bed hospital. We do everything from surgery to transplants, lung transplants, heart transplants. At this point, we do none of that. Almost none of that. Our hospital is almost exclusively a COVID-19 hospital. And so people enter through a secure gate in the front, where in the past, what I've been doing is seeing old people with pneumonias or seeing people with bleeds. Almost exclusively what I do all day long is see people with COVID-19. It's political, it's economic, but what is this disease? So this is a virus. It's from what we would colloquially think of as a common cold family, the coronavirus family. But what's unique is that the human body has never seen this virus before. And so one of the common questions I get is, what does this disease look like? And so what commonly people have is they have fever, and they have cough, and then they have sore throat. And when they get this, the virus goes through their entire body. And what we have found is that the most likely place that this will affect is your lungs. And so people will commonly have cough. But for about 80% of people, you just don't feel good is the most common thing. You have a mild cough, maybe you have a little headache. The disease lasts, from what we're seeing, between 5 to 7 to 14 days is probably the best accurate description. Some people who have a mild disease by about day 5 are starting to feel better. And then people who aren't feeling better usually start to get short of breath around day 3 to 5, and then start to feel better around that 7-day mark. So I think the first thing is, how do you get COVID? And so the overarching theme is sustained contact with someone who has this disease, which the vast majority is people with fever and aches, or someone who is about to get the disease. So someone in the next 1 to 2 days who is going to develop symptoms of this disease. And so the way that you get this is the transmission of the virus almost exclusively from your hands to your face. From your hands to your face. And so it's either into your eyes, into your nose, or into your mouth, face. And so that actually, I think, is incredibly empowering. And that's, as I've been in the hospital the last 2 days, the thing that makes me smile a little bit is that I actually know now that I won't get this disease. because I know how to protect myself. Statement of fact: COVID is in your community. I'm going to say that again. Whether you live in Texas, whether you live in Tennessee, become a hand Nazi. Know where your hands are and know that they're clean at all times. So very simply, for what this means for me in the city is that I walk around with Purell. So when I leave my apartment door and I go to the elevator, it's okay that if I touch it with my hand, but then I Purell it. When I go downstairs and I open the door, it's okay to touch the door. You can open it with your elbow, but if you touch the door, then I make sure to Purell it. So we know that if you keep your hands clean, that you're not going to get this. It's mostly from sustained contact with people who have COVID-19. Out of abundance of caution, we also make sure that everything we touch, we're cleaning our hands. So that's the first thing, is become a hand Nazi. Everything you know about your hands, just keep them clean. And the second thing is you have to start psychologically working on the connection between your hands and your face. So I'm terrible at this. I touch my face all the time, literally all the time. You don't even realize it. You move your hand, you scratch your nose. And so the virus has taken advantage of this. And the reason why everyone gets this disease is because you have sustained contact with someone. So someone at a party has this and you shake their hand, right? And then you touch your face. It's that simple. That is how you get this disease. So what does that mean? I think there's two practical things that you can do. One is just to start to be aware of when you touch your face. Atul Gawande, who is a Harvard-trained surgeon, I think is very famous, actually has a recommendation for people to just start wearing masks. And the idea here is not that the mask is going to prevent you from getting COVID, because as I said, it's not a disease that you're most likely getting from the air. But the reason to put on a mask is because, and I do this in the hospital, is you stop touching your face. And I think those two things combined is incredibly powerful and will prevent the transmission of the disease into your family in 99% of cases. To know your hands are clean and to not touch your face, period. There are going to be an obscure 0.01% of patients who get it and will just never know. But I think for you, that is an incredibly important way to protect yourself. Food from delivery men. We have to go outside to the grocery store. It's a time when we're all really scared. And I think it's what makes it worse is to when you go outside and to look and think that the person next to you is going to somehow harm you or harm your family. But when you know that the only way you're going to get this disease is if your hands are dirty, and that if you touch your face, and that if you are way too close to that person, that becomes incredibly liberating. And then all of a sudden, the person at the store is not your enemy. There's someone who's going through this with you. The delivery person is not your enemy. They're a hero. They're going out and delivering food at a time when there's a communicable disease that they don't understand. What do you do if you get this disease? And this is, I think, if you listen to nothing else through this entire thing, just please listen to this part. In Wuhan, China, throughout the world, the vast majority of spread of COVID-19 is through home and family transmission. So what do you do? If you develop a fever and you are otherwise fine, and isolate yourself from your family. So what does that mean? It's just simply about the same rules about hands and touching your face. Is you don't want sustained contact with the person who's sick to the point where you're going to be able to pick this up off of surfaces or off their person and then touch your face. So what are people recommending? If you're able, have the person in a separate room. If you're able, have the person who's sick have their own bathroom. If the person has to come out and interact with people in the family, this is a perfect indication for one medical mask. And the reason is you want to put the mask on the person who's sick. And so if in our apartment, if I was sick and I had to come out and interact with my family, before I would leave the bedroom, I would wash my hands, I would put on a mask, and then I would go out, feel like shit for 3 to 5 days, feel a little less shit on 7, and then they're going to start to feel better. You can start interacting with your family more as you feel better, as your fever is gone, but you're still going to be vigilant. You're going to be washing your hands. You're going to be a lot more confident 20 days out from the disease than you are 10 days out from the disease. The current recommendation from the CDC is that if I get sick and if I'm feeling better, I can put on a mask and go to work. And so I think that that is a good indication to you that that's when you can start interacting with your family. We get into danger is people being too cavalier when they're developing symptoms and exposing their family too early. And then when they get fevers and they're staying at home, is that they're having too much interaction with your family. You can have COVID-19 in your house and everyone else not get it and be protected and be completely safe. There are a couple exceptions to that, and I think this is important. If you have a vulnerable population in your family, so if you're living with your lovely 95-year-old grandmother, if there's someone in your house who had recent chemotherapy and someone in the house gets sick, you need to find another living arrangement for that patient or practice incredibly, incredibly strict isolation of that family member. We know that the older population is the sickest population when they get this disease. And so that is the one caveat to it's safe to stay home with your family is if you have someone who's incredibly vulnerable. If I get COVID-19 and I feel short of breath, am I just going to go to the hospital and die? This is where I'm probably the most qualified person in the country to comment on what it looks like when people are coming into the hospital and sick. So first, who should go to the hospital? If you're feeling short of breath, come to the hospital. That is the rule. That is the clearest thing. It's not, I have a fever. It's not, I think I have COVID-19. It's not, I can't stop having those body aches. It's, I feel short of breath when I get up to go to the bathroom. A lot of the people that come to the emergency room, we're sending home to live out the 4 or 5 days of their disease so that they can feel better. And the people that come to the emergency room, we're sending home to live out the 4 or 5 days of their disease so that they can feel better. And we say, oh, you look completely fine, go home. But what we're also seeing is that people that feel short of breath, who come to the hospital, some of them go onto the floor and just are short of breath for 5 to 6, 7 days, and then they go home. So of the entire population of people who get COVID-19, about 10% need to go to the hospital because they get short of breath. Of the 10% who are coming to the hospital, about 1 to 2 to 3% of those are requiring admission to the ICU and to be put on a ventilator. So what happens when people get put on ventilators? The vast majority of people, overwhelming majority of people, come off the ventilator. And they usually come off the ventilator 7 to 10 days later. But I think the important thing for you guys to know is going to the hospital is not a death sentence. It's a safe place for you to be. Go to the hospital when you're short of breath. The thing that I think makes a lot of parents, doctor parents in this world, very happy right now is there's almost no COVID disease in the population from age 0 to age 14. So I'll just state that again. Kids are not getting sick. Now, there are some exceptions. There's a recent New England Journal article where they went into a hospital in Wuhan, China, a pediatric hospital, and in the entire hospital of 300 kids, they found 2% of them or 4% of them had COVID, which really looked like cough or asthma. So kids are not dying. Kids are not getting critically ill. Kids are not getting sick. There's a whole debate about whether kids are transmitting this disease. It's probably true. But I think if the gist of the question is how does we are wondering, being in a city, is it really safe to go on a run or a walk, taking in the social distancing measures? Amazing question. Yes, please. If you're in a city, you can go outside or use it in the absence of Purell. I think that's another thing to say to Stella, is this disease is a wimp. Coronavirus is a wimp. It dies as soon as you disinfect it. So I can get back on the exact thing, but just generally any type of disinfectant. And then if you're going out and you don't have Purell, press the elevator with your elbow. Open the door with your shoulder. Is there an emerging understanding or hypothesis surrounding contributing to why certain younger patients in their 30s and 50s have been having acute respiratory course compared to their peers? Are these patients truly healthy, or do they have comorbidities? So amazing, Chris, because I didn't have a chance to address this. And so again, everyone listen, please listen to what I'm going to say. This disease affects everyone who's not in the age group of 0 to 14. So 23-year-olds, 35-year-olds, 45-year-olds with zero medical problems are getting this disease. People like that are coming to the hospital. People like that are going on. I'd like to hear a bit about what it's like treating these patients, a couple stories from the front lines on this thing. It's actually fascinating because they all look exactly the same. Most people come into the hospital, they sit on the floor and they just have fevers. A lot will be nervous, which is completely understandable. They look like anybody else. What we see for people who get sick is they get short of breath, and then over 1 to 2 to 3 days, they get more short of breath, and then they get so short of breath that they can't walk to the bathroom, and then we put them on a ventilator. And then our experience has been that these people usually settle out over the next 1 day, and then between 7 to 10 days later, barring a complication, we're able to get these people off the ventilator. Dealing with these patients is, for a doctor, incredibly simple. They all look the same. They all get the same treatment. For them, it's scary, and it's our job to kind of make them a little less scared. And what I tell every young person or old person that I have to put on a ventilator is, we're putting you on because we are going to get you off. And I think that that's true. So if you have people, or people who are sick and they're short of breath, they shouldn't be scared. They should go to the hospital, and we will take care of them. And so I think social distancing will be for months to potentially a year, which I know sounds like a lot, but I think the experience from Wuhan, the experience from Singapore, the experience from South Korea, is that the first thing you do is you flatten the curve. The first thing you do is you bring down the amount of cases so hospitals don't get overwhelmed. And then by human nature, people will become a little relaxed with their social distancing. And so there's then a second small spike. And then after the second small spike, it usually comes under control in the population. And so I think social distancing is something that you need to just put in your brain. I think it's something that is just the way of life for the indefinite future. But now that you know the rules, it's not something to be afraid of. It's just a different way of interacting. And as this becomes controlled over the next 3 to 6 to 9 months in this country, then you'll know exactly who you'll be able to hug. You'll know exactly who you'll be able to touch. You'll be able to, I think, feel better. Majority, so 81,000 people in China got this disease. 76,000 have recovered with antibodies that prevent them from getting the disease. Wow. The natural course of this disease is that once the world sees it, coronavirus now as a pandemic is going to enter the circulation the same way rhinovirus is in our circulation, the same way that respiratory syncytial virus is in our circulation. But as it mutates, it's going to get milder and milder. And so 5 years from now, you're going to get coronavirus, this exact COVID-19, and it's going to feel like a cold, just not the first time through the population.